It's a beautiful afternoon. Glad to have you join us on today's edition of the program Healthcare. It's coming to you live on the TV arm of PRTVC right here in our Rayfield studio. And you know what we do always on Healthcare? We get to educate you about your health, how to take care of yourself, and how to handle your health. My name is Plangret Dabang, your anchor. And on today's edition of the program, as always, promises to be informative, educative, and interactive. Halfway into the program, our phone lines will be open for you to call in to be a part of the program. And when it's time, don't forget to kindly turn down the volume of your TV sets or you move away from it so we can hear you. Right, so for the next hour, I will be your company. So I would say stay glued to your TV set, get informed and educated about your health today. And on today's episode of the program, we'll be looking at the World Hepatitis Day. The celebration was yesterday. So today we are not too late because you will get to be educated. Peradventure you missed out on the celebration of the day yesterday. And I've been joined in the studio this afternoon by Dr. Duguru Mary. She is an associate professor, a consultant gastroenterologist and hepatologist, Department of Medicine, Jos University Teaching Hospital. Good afternoon, doctor. Thank you so much for coming on Healthcare.
Good afternoon, viewers.
All right.
Thank you.
So, hepatitis, what does it entail?
Well, I'll say hepatitis simply means inflammation of the liver. When we say inflammation of the liver, usually when you have an infection, your body will try to produce antibodies to fight against this infection. So these antibodies will try to clear the infection. So, but in the case of hepatitis, the infection tends to persist. So I say it's chronic. So it brings about damage to the liver. So that is why we call it inflammation of the liver.
Okay, so how common is hepatitis in this part of the world, and why the need for this advocacy?
Wow, hepatitis is very, very common. Recently, the World Health Organization puts that about 2 billion people are having current or past infection, and about 240 million people are living with this chronic infection. So, and then on the plateau, we have prevalence rate of 10 to 15% in the general population, and we have as high as 22%, depending on the group of people you are studying. Like for people that are in correctional facilities, they tend to have higher prevalence of this disease condition. In pregnant women, there's a study that was done in Jos that found out that pregnant women have about 9.2%. You can see that it is very, very alarming because the WHO puts the prevalence for high rate at 8%. But you can see for Plateau State is beyond that. So that is why it is very, very important that advocacy should be carried out so that people will know exactly their status when it comes to hepatitis B, because it is dangerous.
Is there any other message the celebration of World Hepatitis Day wants to portray? Seeing the theme, let's break it down. Get the fact, get vaccinated.
Yes, the World Health Organization, in collaboration with World Hepatitis Alliance, puts on a call towards that to break the barriers that is inhibiting people from getting prevention from hepatitis B. And there are several barriers that we were able to identify. Barrier of stigmatization, barrier of poor access to healthcare, and barriers of poor funding from the government. There's so many other barriers that they discovered. So that is why they're advocating that even the community, individuals can play a role. Social societies can also play a part. It's not just one person, everybody, including what we're doing here today. We're educating people so that they know that they have to go for testing, early testing and accurate testing, and also get accurate information. Because a lot of times people don't get the accurate information because they get different information telling them not to be treated. Maybe they go for traditional medications. This is a big problem for us. You understand? So that is why WHO is advocating for that.
Okay.
Yeah.
So I know there is hepatitis A, B, C.
Yes.
How
Yes.
do they vary?
Okay. The hepatitis, we say this particular group of hepatitis, we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E. They all have special, we say the special interest or affinity to affect the liver, particularly. But hepatitis A and E do not cause chronic infection. So once you have infection with it, your body is able to produce antibody that clears the infection and then also protect you against subsequent exposure to these particular viruses. But in the case of hepatitis B and C, they tend to cause persistent infection or chronic infection. And the reason is because of the mode of transmission in our own environment. Because Nigeria happens to be in the sub-Saharan region, where most of the transmission of this virus is through from mother to child. So they acquire it early in childhood when their immune system is not fully developed. So they go on to become chronic carriers of this virus. And it goes on to damage the liver gradually over a period of time. And then they subsequently present with either liver cirrhosis or cancer of the liver, which is the two most dreaded complications that we don't want our patients or any person to ever have.
Okay. So before we come down to the mode of transmission, from the clinical perspective, are there misconceptions patients come to the hospital bearing at heart?
Yeah, we have a lot of problems because like when patients sometimes they get tested for the hepatitis and they are told they have hepatitis, they just tell them don't bother to do any treatment because it's not causing any problem. That is where the problem is. The no symptom, no signs, no headache, no fever, no nothing. Until the virus has done so much damage to the liver, that is when the patient will now start presenting with abdominal swelling, jaundice or yellowness of the eyes. They become very black. You see their nails looking white. They start vomiting blood. So there are so many symptoms. In a man, you see a man developing breast, and it's usually very painful. So they will also have problem of infertility, both for men and women. The women may not menstruate because of that. So they have so many other symptoms that they can present with because of the fact that they did not do something early enough about it.
Okay.
So those are the misconceptions
that
you see people get in the community.
All right. So to the mode of transmission now, you made mention of mother to child.
Yes.
Is that the only mode of transmission or there are other modes
No,
of
there are
transmission?
many other modes of transmission of this virus. Apart from mother to child, people that get blood transfusion, if the blood is not screened, so we encourage that everybody must get transfused with blood that is properly screened. In that screening, they must check for hepatitis B, they must check for hepatitis C and HIV before the blood is given to you. And then people that share sharp objects like razor blades, clippers in the barber salon, sharing of those instruments can also predispose one to having that infection. And then we also have tribal marks. You know, people go to do tribal marks. They take their children to the village. And when you see, because we've been opportune to visit some of these sites where they practice all those things, you will see that the herbalist or the person doing the procedure will tell you that I inherited this blade or this knife from my great-grandfather. Wow. So they attach some meat to it. They will tell you that they cannot wash it. They cannot put any chemical on it because it's forbidden. So they just use it to give the marks or to do the circumcision. After that, we just use some concoction to clean it and make some indentation and then go to the next person without really sterilizing it. So we educate them on the need to for every parent to come with their own so that they can prevent that infection. And also the sharing of people that do injection drug use, people that do drug abuse, they share needles. So they are at risk of having those infections. So those are just a few that I mentioned. Even having multiple unprotected sexual partners can predispose you to having hepatitis B virus infection.
Okay. So someone will be wondering, what is the main cause of this hepatitis?
The main cause is hepatitis is caused by a virus. It's a virus. They call it hepatitis B virus or hepatitis C virus. They're the ones that cause the chronic infection. So when we say hepatitis, like I defined earlier on, that hepatitis inflammation, the presence of a virus in your system. Your body tries to clear it. Right. So because it becomes persistent, so it damages the liver.
Earlier like no symptoms.
Yes.
So does that mean there is nothing to look out for?
Yes,
as far as hepatitis is concerned at the initial stage.
Yes, at the initial state of infection, there is no symptom. The patients look normal, just like any other normal person. They go about doing their normal activities, eating all that they can eat, doing what they can do. They can go to work, they can do games, they can do everything without any symptom. But by the time the infection is taking some years, like 10 to 15 years, 20 years, that is when the problem will now start. That is when the liver is now getting tired because of the inflammation that is ongoing in the liver. So the patient will now start complaining of excessive tiredness, maybe the activity they used to do before without any problem. They now discover that they cannot do it again effectively. They may have poor appetite. They may notice that their nails is becoming white. They are developing what we call finger clubbing. They become very dark in color. They begin to vomit blood. So they have a myriad of symptoms that they will now start presenting with. Then the abdomen will now swell up, and the legs will also swell up, and then they vomit blood. So these are the extreme of the complications of the disease condition.
All right. So to blood transfusion now, in some of the instances where you will need a transfusion, you are very down and possibly without so much strength to, ask questions. So how will you as a patient now ensure that whatever blood that will be transfused is properly screened?
That is why we encourage people that they should receive blood transfusion in hospitals, institutions that are known and registered. You don't just go to a quack place, because sometimes some people know. Sometimes when you have problem, you go to a place, they tell you maybe you're paying 10,000. You go somewhere else, they say bring 1,000. You know that definitely there's something wrong with that place. So it's not a place you should receive your blood transfusion. So everybody is encouraged to go to a hospital and get blood transfusion, because in the hospitals it's mandatory. It's a law. It's there. They will always check for all these viruses before they transfuse the blood to the patient.
So since there are no symptoms at the initial stage, at what point should one get tested for hepatitis?
At every point. That is why we say at every opportunity you have, you present yourself in the hospital. Even if you have malaria, you go for malaria treatment. It's an opportunity for you to check. If people are getting jobs, if you are going for pre-employment screening, you should also get pre-school era, you also get screened. So every opportunity, women that go for antenatal clinic, we encourage them. They are all screened for hepatitis in all the primary healthcare centers, in the teaching hospitals, in the specialist hospitals. It's a standard in the state, because the Commissioner of Health for Plateau State is very passionate about this whole thing. So it's ensuring that every time people present in the hospital, they should get screened for that.
Okay. Viewer, if you've just tuned in, the program is Healthcare, and it's coming to you live on the TV arm of PRTVC right here in our Rayfield studio, and we are looking at World Hepatitis Day that was celebrated yesterday with the theme, Let's Break It Down, Get the Fact, Get Vaccinated. And Dr. Duguru Mary John, an associate professor, consultant gastroenterologist and hepatologist, Department of Medicine, Just University Teaching Hospital, is doing justice to the topic hepatitis today. Stay glued to your TV sets, because I believe you are getting enlightened, and we have more for you on the program. Right, so how frequent should one get tested for hepatitis? 1 month, 2, 3?
No, you don't have to repeat the testing all the time. Once you screen yourself and you are found to be negative, we encourage that you go for the vaccination. And the vaccination is usually given 3 doses. It's mandatory that you get the 3 doses, because that's the only time you have confirmed. And after the vaccination, it takes several years. It all depends on what is happening to the individual. Because most of the time, in some cases, it's for life once you are vaccinated. But sometimes when individuals fall sick, maybe when you become diabetic or anything that is depressing your immune system, the level of the antibodies may reduce. So we encourage such a person to go for a booster dose. And those people that have they are tested positive, we encourage them to go to the hospital. They will get further evaluation and will be placed on medication so that it will not prevent them from developing cirrhosis and cancer of the liver.
Okay. So are there specific centers you would advise an individual to get tested, or any health facility you see?
Yes, yes, there are so many health facilities that is owned by the government. All the private centers are screening for hepatitis. It's mandatory normal routine. The specialist hospital, the teaching hospitals, they do that. Even some private hospitals and some non-governmental organizations the nearest point they think is possible for them so that they can get screened.
Okay, so how affordable is the test? Because a lot of people will be saying, the country is hard, so I don't know how it is financially, so I need to get myself ready before going to the hospital.
Yes, the screening for hepatitis is not very, very expensive. I can say for some places they do for 1,000 naira, so it's something that is quite affordable. So it's possible. Okay. It's doable.
So is hepatitis curable or a death sentence?
It's not a death sentence. Like I always tell my patients to encourage them. Hypertension, that is systemic hypertension, diabetes, they are not curable diseases, but they are diseases that can be controlled with drugs. And also your lifestyle modification will also help. So hepatitis B in particular has no cure. But there are drugs that one can use. It helps to bring down the virus under control so that it does not destroy your liver. So you are able to live a very normal life. But for hepatitis C has a cure. It has a cure. There are drugs that can be used to treat the individual and they get complete cure from it. But hepatitis C does not have vaccine. Yes, it does not have vaccine, but it has a cure. But hepatitis B does not have a cure, but it has vaccine. So that is why we want people to go and test. They don't wait until they fall sick. You don't wait until you become infected. Get tested, do the vaccine, which is 100% protective against the hepatitis B virus.
Okay.
So that is why we're doing this advocacy.
Okay. So peradventure, an individual gets tested positive to hepatitis.
Yeah.
What's the first thing to do?
The first thing is to present yourself to the hospital. Yes, you go to the hospital, you tell them, you can come along with your results if you have it. You tell them that, I have tested positive for hepatitis B or it's hepatitis C. So the doctor will now request further investigation to see, like for C, we need to know the degree of damage in your liver because it will tell us for how long we are going to be able to treat you. And then for B, it will also tell you the extent of damage to the liver because sometimes you see some individuals, they have already developed cirrhosis, but they are looking very normal without any symptom. So by the time you are checking, so you'll be able to advise them even after that because there are other things that you need this patient not to do. Things like alcohol, because alcohol also causes hepatitis. We call it alcoholic hepatitis. And it can also lead to cirrhosis and cancer of the liver. So if you have hepatitis B, you must not do alcohol. Because if you are doing alcohol, that means you have 2 risk factors. So you are likely going to develop the cancer or cirrhosis on time. So, and then things like cigarette smoking, herbal medication. So because some of the herbal medication, we don't know what is the composition of this herbal medication. And we don't know the quantity that they are taking. So I've seen a lot of patients that say that they told them they have hepatitis B and they just start taking herbal medication. The moment they start taking it, they just go down into liver failure and they die from it. So these are all important things that patients should know.
Is it communicable?
Yes, it can be, yes. That is why the different way, not just communicable, just by talking to you, like yesterday I gave some lectures, talking to somebody that has hepatitis, sitting next to somebody, shaking hands, hugging will not transmit the infection. Sharing kitchen utensils, toiletries and stuff like that will not result to hepatitis. But if there is bodily contact, that is very close contact with somebody, especially if there is blood contact with an individual that has hepatitis B, you are going to be at greater risk of having that infection.
Okay.
So that is why we say people should not share sharp objects.
Okay.
You know, sometimes maybe in the process, like you see women do manicure and pedicure in the salons. Sometimes you see them scraping the legs, the palms, cutting, you know, and sometimes blood comes out. And they don't sterilize it. Or at most they use this methylated spirit. The methylated spirit they are using is just like water. It's not really effective enough. And hepatitis virus cannot just be destroyed by just using that. You understand? So it is highly infectious. It's 100 times more infectious than HIV.
Okay. So how can caregivers protect themselves when caring for people with hepatitis?
Yes. So that is why we encourage people, like family members, like what we do for them in the teaching hospital. Once we see any patient in the hospital that has hepatitis and we're caring for him, we automatically screen the relations. We always talk to them. We offer them a pre-screen. We check them. If they are positive, we also evaluate them further for treatment. But if they are not, we advise them to just go immediately for vaccination. And then when they are caring, especially when they are coming in contact with maybe their feces, urine, and maybe blood, we encourage them to use hand gloves. So that, you know, sometimes you can have some injuries on your palms that you are not even aware of. So if you are going to handle the blood, you have to wear something protective.
Okay. Yes. And talking about vaccines, how effective are they?
The vaccines are highly effective. I said about 100% protective once we get it. That is why I said the 3 doses must be given. You know, sometimes we see some individuals who go for the first dose, they don't go for the second or the third dose. So it will not confirm immunity in that person. So we encourage that you must collect the 3 doses of the vaccine.
Okay.
Yes.
And then the issue of stigma. You know, when people know you have hepatitis, everybody tends to run away from you.
Yes.
And there's this isolation. So you end up feeling very bad. So how can the society now embrace people that are living with hepatitis so others can also be encouraged to get tested, know their status, related, plus treatment?
Yeah, that's why we are doing this program today. It's one of it, the health education, because it's knowledge is power. Because if you don't know, you are going to stigmatize such a person. But I mentioned earlier on that sitting with the people, eating with them, showing love, hugging them will not transmit the infection. Because if people know that these ways cannot transmit the infection, they are unlikely going to stigmatize against this patient. So that is why we encourage people to get this health education wherever it is important. Even in the hospitals, like all this PHC that I talked about, they do health talk. They do give health talks to people when they come around. So, and then when we see them in the hospital too, we always encourage the relation. We talk to them that this is not a death sentence, that the infection cannot be just acquired by just, shaking hands, eating with them, showing them love and things like that. No, we must show them love. We must show them respect. Because it is not just by their own doing that they have the infection. Like I told you earlier on, the majority of the people acquire the infection from their mothers to child. So they don't even know that they have the infection. You understand? So we must show them love. We must respect their person.
Okay. So the World Hepatitis Day was yesterday.
Yes.
Can you take us through the event yesterday for people that were not opportune to be there? What happened? What did we miss?
We missed a lot. Like I told you, I said the Commissioner of Health is wonderful. He's very passionate about the whole thing. You can see that he invited different categories of people. He invited the social, civil society, placard, different organizations, youth, every other person, the normal community, everybody, they came to participate in World Hepatitis Day. It took place in CRISPR. I gave a talk on enlightenment, awareness on viral hepatitis. And then from there, they took a walk from Old Airport Road down to Secretariat, distributing flyers to people on the Hepatitis Day. And after that, there are some centers in Duguru, the primary healthcare center in Duguru. We have one in Duguru, the Cottage Hospital. And yes, so they did free testing for people and free vaccination for people that tested negative. And those that tested positive, we have a special card that we're giving them. So we're going to link them up to care. We're not just testing them and leaving them like that. Understand? So we're linking them after they are we said that it is important that everybody should go out, test, know your status, and then care.
Viewer will be back in just a moment. Please don't go.
Your toothbrush.
Welcome back, viewer. If you've just tuned in, the program is Healthcare, coming to you live on the TV arm of PRTVC, right here in our Rayfield studio. And this is where you get the opportunity to join the program this afternoon. And you can do that by calling the number 090 6191 0191. The numbers are on your TV screen. Do well to call in if you have questions, you have concerns, you need clarity. Please ensure you call in. And we are privileged to have the doctor in the house, and I believe she will be delighted to respond to whatever questions or concerns you have regarding hepatitis. Don't forget to kindly turn down the volume of your TV sets, or you move away from it so we can hear you. The numbers are on your TV screen, so please keep those calls coming in. Would love to hear from you. So before we wait for calls to come in, aside vaccination, are there other preventive measures or steps families can take to ensure everyone is safe?
Yes, like I said earlier, most of the time the infection is only gotten if there's close blood contact with someone that has infection. As long as that is not there, it's unlikely any member of the family is going to get that infection.
Okay.
Yeah. So the vaccination is excellent. So that is why we encourage people to do it. So if other members of the family do not have the infection, we encourage them to be vaccinated. That way they'll be protected.
Okay. So you earlier made mention of smoking and drinking.
Yes.
Are there other healthy lifestyle people can practice just to ensure that because I know your lifestyle has a lot to say as far as your health is concerned. So aside smoking and drinking, what other healthy lifestyles can one practice?
So we encourage people to balance diet, because a lot of times when people have this infection,
so they tell you short list if you can take this call. Hello. Good afternoon.
Thank you very much for that program.
Well, with you, turn down the volume of your TV set, please.
Yes, I'm calling from building materials.
Okay.
I heard what the doctor is saying, and there are some people say that some people are carriers. I don't know how about those who are carriers, can they take the vaccine?
Okay. Thank you so much for calling. Stay tuned. The doctor will respond to your question shortly. The numbers are on your TV screen. Do well to call in, and please turn down the volume of your TV sets or you move away from it so we can hear you. So keep those calls coming in. It will be a delight to hear from you. All right, so you were talking about lifestyle modification.
Yes. So a lot of times we see our patients, once they come to the hospital, they are told not to eat meat, don't eat fish, don't eat beans, don't eat palm oil, don't eat groundnut oil. All the nutritious food they are asked not to eat.
Not to eat.
So we tell them no. It is very, very wrong, because once they stop eating all this, they become very sick, because their immune system will become depressed. So the virus will now multiply faster. That is, it will increase in number in their body and then cause more damage to the liver, and then it results to cirrhosis and cancer early, before when they are supposed to develop the infection. So we tell them, no, you have to eat this food. This food will help to build your immune system. It will help to build more antibodies to help control the infection in your bodies. So those are the things that we expect people to do. They should not stop eating their meal because they have hepatitis.
Okay.
Yeah.
And I was supposed to ask you about diagnosis.
How
How is it done? This question should have come earlier.
Yes.
Before now.
Okay, diagnosis is very simple. When you go to the hospital, the lab scientist will take your blood, and then they test it. They have a special test strip that they use to test for the virus. So it will tell whether it is positive or it is not positive. And once it becomes positive, then you do further. There's a test we call fibroscan to tell you the liver. We do the liver function test. You do the viral load. These are all important investigations that must be done for us to be able to treat you.
The numbers are on your TV screen. Do well to call in. It will be a delight to hear from you this beautiful afternoon. Right, so the caller was asking about carriers. Is it safe for them to get vaccinated?
No, the carrier infection. That is what it means. So when you have the infection, just like in the initial phase I told you, the people have the infection. They don't even know that they have the infection. They don't have symptoms. They don't have any sign that they have this hepatitis. When you check them, they say that they are carriers. Yes, they are carriers of the virus. That is why I said they will do further investigations. This investigation I just listed will tell us whether there is ongoing damage in your liver or not. So it's based on that we know the kind of treatment we are going to give you.
Okay.
Yes, so they don't get vaccinated because already the individual has the infection.
Okay.
Yes.
So aside the liver cirrhosis you made mention of, are there other complications one can come down with from lack of treating hepatitis?
Yes, apart from liver cirrhosis, there are some things, there are actually medical terminology, but I'll try to use simpler words. There are people that have vomited blood. If you have heard that people are vomiting blood, there is some veins in the throat. They become enlarged. So we call them varices. So if they become so big, they burst, and the individual will not start vomiting blood. I remember some years back, some people came to the hospital. They were like, oh, he went drinking, and he went to use the restroom. By the time he came back and drank his alcohol, he started vomiting blood. So he believed he was poisoned. That was why he started vomiting the blood. But it is not, because he actually has cirrhosis of the liver. So when you have cirrhosis of the liver, you have that complication. Those veins in the throat will now become big, and they burst, just like a pipeline. When it bursts, the individual will now vomit blood. So we call it varices. And the vomiting can be very, very scary. And sometimes people even die following the vomiting of blood if they don't get transfused immediately.
Okay. So you spoke to us about healthy lifestyle. So for people that are living with hepatitis, their lifestyle, is it same when it comes to modification, or there are certain things people that have hepatitis should not do, the do's and don'ts for
yes, that's why I said
smoking and drinking?
Yes, this smoking and drinking in particular is a big problem, because we see a lot of people with it. Apart from that, even the kind of food you eat, because there are other things that can further worsen the person's situation. Like you go to the market, sometimes you see some food that have developed moles. You know moles, those black things that grow on food that is going bad. They also produce some chemical that can cause cancer of the liver.
Okay.
So you see, especially now that poverty is a big problem, so people will see that their food is bad. They don't throw it away. They still go ahead to eat. So we encourage them they should not eat those kind of food. And this herbal medication that people are taking, they will tell them herbal medication, no dose, just any quantity. You understand? We don't know what is the composition of that herbal medication. So we advise them not to be doing that, because doing some of those things can further damage the liver, and the patient can die from those complications.
Okay. Viewer, the numbers are on your TV screen. Do well to call in if you have questions, you have concerns, you need clarity. We are talking about World Hepatitis Day. Please do well to call in, and we have a specialist in the house, and she will guide you as far as your health is concerned. So please don't keep that concern to yourself. Don't keep that question to yourself. We are privileged to have a person that will give you first-hand information. It will not be a hearsay, but facts. So please do well to call in. The numbers are on your TV screen. Hello.
Hello, good afternoon.
Good afternoon.
My name is Jennifer Danat.
Thank you for calling, Jennifer.
So I have to ask, what causes hepatitis?
Okay. Thank you, Jennifer. Stay tuned. The doctor will respond to you shortly. I believe Jennifer joined us late. Keep those calls coming in. The numbers are on your TV screen to join us this afternoon. It will be a delight to hear from you, because without you, we will not be here. And having your calls give us that encouragement that we are not alone. We have people watching. We have people that are also learning. So please do well to call in. Hello.
Hello.
Good afternoon. Can you hear me? Okay. Please call back if you can. The numbers are on your TV screen. We would love to hear from you. Keep those calls coming in. So could you just respond to Jennifer? She wants to know the causes of hepatitis.
Okay. Earlier on, I said hepatitis is caused by a virus called. Okay.
Please
hepatitis is caused by viruses. Hepatitis B virus, hepatitis C virus, hepatitis D virus. We have hepatitis A and E. I said A and E do not cause chronic infection, but hepatitis B and C and D, they cause chronic infection.
Okay. Hello? Can you hear me? Okay. Please don't get tired of trying to get through to us in the studio. We would love to hear from you. The numbers are on your TV screen, so please do well. Call in and be a part of the program this afternoon. So to our environment now. Does our environment has any role to play as far as hepatitis is concerned? Before you respond, let's see if we can take this call. Hello? Good afternoon.
I'm calling for
What's your name? Go ahead, Samuel.
You guys said that eating together with someone that has hepatitis. Can I come in contact with
Can you come in contact with what?
the hepatitis?
Okay. I don't think I understood what he was
I
saying.
understand the question.
Okay.
Yes.
Okay. So please, you could just respond to him before we come back
Yes.
to.
Okay, eating with somebody that has hepatitis will not make you have the infection. I've said that earlier on. Eating with the person, sitting next to the person, sleeping on the same bed, using spoons and knives that the person eats food with will not give you the infection.
Okay.
Yes.
All right. So back to my question.
Yes.
The
I was
environment.
talking about, the environment. No, the environment does not really play a role, because this virus is in somebody. It's not something that maybe by coughing or talking, it can affect somebody close to you. No.
Okay.
Yes.
All right. Hello.
Hello.
Good afternoon.
Good afternoon, ma. Sorry, I joined your conversation lately. I just want to ask pertaining the vaccination. After taking the 3 doses, For how long is it going to last?
Okay. Thank you so much for calling. Stay tuned. Doctor will respond to you shortly. The numbers are on your TV screen. All right. So you can just be like the last caller. You just tuned in and you're wondering what are they talking about. You can still call in because it's always delightful when we know that our viewer is carried along on every episode of the program. The numbers are on your TV screen. Please do well to call in. Hello? Hello? Good afternoon.
Good afternoon.
Thank you for
I would like to ask,
your name.
can hepatitis be caused by transmission of fluid?
Come again.
Like saliva? Like can it be caused by fluid, such as saliva?
Okay. Can you contact hepatitis through fluid? We didn't get your name. The numbers are on your TV screen. Please keep those calls coming in. We'd love to hear from you. Hello? Hello? Can you hear me? Okay. The numbers are on your TV screen. Please keep those calls coming in. We'd love to hear from you this beautiful afternoon. Hello, good afternoon. Thank you for joining us. Your name and location. Okay, we can hear you, Jennifer.
So I have to ask this kind of food if that hepatitis can eat.
Okay, food. Thank you for calling. I believe she also joined late because we've responded to this. But then, because we are here for them, we'll just respond to them again. Hello? Hello? Please turn down the volume of your TV set. Okay. Don't forget to kindly turn down the volume of your TV set or you move away from it so we can hear you. The numbers are on your TV screen. Do well to call in. It will be a delight to hear from you. All right. So, how long does the vaccination last?
Okay, I said that in most cases, vaccination is usually for life once you develop antibodies for the virus. But sometimes I said when people fall sick, when they become diabetic, or anything that suppresses their immune system, it can make the antibodies to reduce. So in such situation, we encourage people to go for a booster dose.
Okay.
So, and there are other tests. If they go to the hospital, there are other tests that can be done to see whether they still have the antibodies or not.
Okay.
You'll be able to tell them.
Okay. So can you get infected via fluids?
No, saliva, urine does not really transmit the virus. It's not transmissible. That is why even pregnant women that are breastfeeding their babies, we don't stop them from breastfeeding their babies. The main route is when there is blood contact. That is why I said even sharing toothbrush, because in the process of brushing, sometimes you can injure your gum and you see blood coming out. We don't encourage that. But saliva will not transmit the infection.
Okay. Hello? Good afternoon. Go ahead, we can hear you. Go ahead, Jeremiah, we can hear you. Okay. Jeremiah wants to know if hepatitis is a death sentence.
It's not a death sentence, Jeremiah. If you have hepatitis, come to the hospital. There are drugs for it.
Okay. And someone wanted to know foods that are advisable for people living with hepatitis.
Okay, I said that people should eat, in our own terms here, we say balanced diet. You should just eat your normal food, balanced diet, like you are used to eating. There's no any specific food for people that have hepatitis.
Okay.
Yes.
All right. So, are you seeing the possibility of hepatitis completely eliminated from our society?
It's possible. There's nothing that is not possible. It all depends. That is why we're doing this program today. Because if people are enlightened, people are aware, they know the many routes of transmission of this virus, and they protect themselves against it, of course. And then we take the vaccine.
Okay.
like we are doing now, because there are several studies that have been done elsewhere where children, pregnant women were treated. They look back 20 years later, 30 years later, they saw that the whole population, there were no people with hepatitis. So it's possible here, if we continue this advocacy thing, enlightening people on the many ways that this infection can be acquired and how to protect yourself against it. And for pregnant women in particular, I told you that the main route of transmission in our environment is mother to child. So if we are able to treat all the pregnant women, give vaccination to their babies, like when they give birth to babies of mothers that have the infection, immediately after birth, we give something we call immunoglobulin for hepatitis B.
Okay.
So that it will prevent that child from having that infection. So you see, if you look subsequently in the near future, we are going to see a society where hepatitis is no more a problem, because the mothers are being checked, the mothers are being treated, the babies are also given the vaccination. And the birth dose vaccine is practiced everywhere in the primary healthcare centers, in the teaching hospitals, in the specialist hospitals. In most hospitals now, once the woman gives birth, they give the hepatitis B vaccination. So we call it the birth dose vaccine immediately after birth. So that way we protect the child from developing the infection.
Okay. So I know when it comes to health, it is everybody's business.
Yes.
You can't say because I am not infected, this one no concern me.
Yes.
We all have a role to play.
Yes.
So how can we as individuals, as community, come together to ensure that we are having a society that is healthy for all to live? Before you respond, let's see if we can take this call. Hello?
Good afternoon.
Good afternoon.
I am Alanga Danjuma from Duguru.
Thank you for calling, Alangay. Go ahead.
Yes, ma. I was diagnosed around 2019 with hepatitis C, and I was given medication, which when they diagnosed me again, the thing was showing just small, but I'm not feeling anything much. But up to now, if you see my physical appearance is not friendly, and my clothes, especially the trousers, now oversized. What may be the cause?
Okay. Doctor will respond to you shortly, and he is our last caller on the episode of the program, so please respond to him.
Okay.
Before we go ahead.
Okay. I would like to see you. I don't mind. I'm in Jos University Teaching Hospital. If you come to the MOPD of Jude, we'll be able to do further evaluation for you. You said you had hepatitis C and you treated, but I don't know the medication, because a lot of times patients will come and tell me that they have been treated. Only for me to discover maybe they are just taking vitamin B complex. That is the treatment that they are saying that they have taken. Because there's a special drug for treating hepatitis C virus. And I told you earlier on that it's a cure for hepatitis C. So for him to be losing weight, I cannot really say much now until I evaluate him, check the liver, and be sure that there's no cirrhosis or cancer before I can.
Okay. So to the question I ask.
And also maybe he's not eating food because of this problem, because a lot of times they tell them don't eat meat, don't eat that, so they will lose weight. So there are many factors. So for now, I cannot really say because I've not seen him.
Okay. Yes. So how can we as individuals play our role in ensuring we have a society that is free of hepatitis?
So as individual, first and foremost, we must stop or avoid stigmatization. That is where the thing starts. Because this stigma, you can have somebody in your own family that has, and then you don't want to talk to the person, you don't want to have anything. Of course, you know that will not eliminate hepatitis. Because subsequently, when people have this infection, they will rather keep quiet and wait and die, and then continue to spread the infection. So stigmatization must be avoided. We must show love, we must show care, we must show respect. We must go with them, when they are going for their medical care and things, we must show them love and go with them and do all of that.
All right.
That way we'll be able to. In the community too, we encourage people in the community, even like these health talks, we encourage people in communities that they can invite doctors. There are community physicians that are very good at doing all of that, because at that level they are doing preventive medicine. They will talk to the community, explain to them the various ways that this infection is acquired and how they can prevent it.
Okay. So your parting shot as we wrap up the program.
Yes, our parting shot is I want every one of us to get tested. And when I say tested, accurate testing, not just anyhow testing. It has to be accurate because there are some places you go, you do some tests. They tell you you don't have hepatitis, meanwhile you have it. So you have to go to the correct facility to get tested. And then if you don't have the infection, go for vaccination. And the vaccination must be the 3 doses. That's the only way you are sure that you are going to be prevented from having this infection. And if you test positive, go to the hospital. In the hospital, further evaluations will be done and the appropriate medications given to you.
Okay.
Thank you.
All right. Dr. Duguru Mary John, Associate Professor and Consultant Gastroenterologist and Hepatologist, Department of Medicine, Just University Teaching Hospital. Thank you so much for coming on the program today and doing justice to the topic.
Thank you for having me.
All right.
Thank you.
Well, viewer, you've heard it from our guest. Hepatitis is not a death sentence, but you have a role to play in ensuring you are safe from hepatitis by getting vaccinated if you are not positive. And if you are positive, get your treatment and you will be just fine. Plus, you get to protect people around you. This is the much we can take on today's edition of the program. To all those that called in, we sincerely appreciate you for being a part of the program. Healthcare will be back on your TV screen next week, same time, same station. And a repeat of this edition will be on Monday from 11 a.m. till it's 12 p.m. On behalf of the entire production team, my name is Plangret Dabang. Please ensure you're taking good care of your health.